At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Migraines and Headaches on Wednesday, March 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome Sunday. It's a beautiful day outside. We've kind of had hit and miss all week long in the Washington metropolitan area, but listen, it's pretty today. So make sure you get outside and enjoy it and have a great time and go for a walk and stretch your legs a little bit, get away from everything. But if you go now, make sure you take me with you. And don't forget, as soon as we're done with the program today, we go right into live stream on Ageless Health. And you're going to enjoy it. We've got another great program. We have a phenomenal guest. Dareth Painter will be with me, and we're going to be talking about using thermographic imaging to determine pain patterns within the body. It can be extremely accurate and very specific, and we'll tell you all about that. But just so you understand how you can get there, you can go to drtomroselle.com. And if you follow me on any of the social media sites, everything from YouTube to Instagram to Facebook to LinkedIn and so forth, follow me and they'll let you know when we're there. So we want you to have as much opportunity as you possibly can to be able to follow, everything that we're getting done. It's an important process. It's something that you need to make available to yourself and make sure that, you have all the information to take care of your health and your life and your family well-being and so forth. So that's what it's. Anyway, let's get into the program today. We're going to talk about migraine patterns again a little bit, and because that's the topic of our program. March 13th, 6 p.m. at the Roselle Center for Healing in Fairfax. And, migraines are one of these things that, as we said before, knocks out a huge segment of the population, far more than most people would even begin to think about. And most approaches are simply take this and let's see if we can keep it under control. But that's not okay. We want to know the processes. Now, you know what a prodromal is? That's that, here's what happens just before the migraine hits. They can be many different things. It can be twinkle, twinkle, little star, meaning that you get all these little, starlight presentations around your eyes, and then all of a sudden, boom, you got this headache. It can be something as simple as mood changes and depression, and you can go actually back and forth. It's almost a schizophrenic pattern from depression to euphoria, food cravings, neck stiffness, increased urinary pathways, frequent yawning. Your body's doing things to try to protect itself, and we'll get into that a little bit and talk to you more about that on the 13th at the Roselle Center for Healing. And by the way, to register for that class, simply go to rosellecare.com and you can register right online or call the office 703-698-7117. And, we'll be there. So you can have that aura. We talked about that a little bit, that visual disturbances. And, you're seeing shapes and distortions and flashes of light and the like. Even vision loss. We know that we have ocular migraines, and that can affect the eyes. And sometimes we get really nervous and we think that it's a result of a retinal detachment or things of that nation. Pins and needles in your arms and your hands, weakness and numbness in your face. All of a sudden, you think you're having a stroke. Well, the symptoms can be similar, and it's never okay to have these things. Also, difficulty speaking. A lot of people would say, well, doc, do you have that problem? No, not really on an ongoing basis. But if you have the inability to articulate, it's not a sagging type of thing. It's not post-stroke. But you have to remember that by definition, a migraine is a vascular blood supply, some sort of problem that way. It can be inflammation. It can be restriction of blood flow, multiple pieces of that puzzle. And it often is a result of liver function and a result of intestinal tract and a result of spinal misalignment, which is almost always involved at one part or another. The headaches that go along with a migraine, the pain is usually one-sided more so than the other. It's throbbing, it's pulsating. The sensitivity to light and sound. It's like, turn the world off, let me put a pillow over my head, take 1,000 painkillers and do that. What happens after the migraine is that there can often be a feeling of being confused. You're not able to orientate yourself the way that you normally do. It can be that you're washed up, you're totally drained, you can't get it back together. Some people may feel opposite. They may feel elated for some reason. And that's because the neurochemistry of the brain, or the neurochemistry that's produced in the body that affects the brain, is altered at that point, and you have high levels of things that shouldn't be so high. I'm going to go through that on the 16th. I'm going to tell you how to identify some of these things. And some of it is a result of these little things called neurotransmitters not working as they should. And when I say not working, what I'm talking about is they're not abundant, or there's way too many of them. And there's easy ways of finding out about that. And one is urinary neurotransmitter test. And right now we're looking at brain span testing and see what happens in that area. So a combination of many things can make a huge difference. There can be predispositions to the migraine pattern, and it can be a familiar type of thing. You often find, particularly with women, and by the way, migraines are far more in women than they are in guys. It seems to pass on, and somebody in the family is going to have it, or somebody else in the family had it, and that's a hormonal migraine. And it's often a result of imbalances in hormonal patterns, but also it's a result in the inability of the liver to detoxify the hormone, particularly estrogens. If estrogens get too high in the body, they're what we call hydrophilic. That means that they love water, and they pull water into the tissue, and it causes a compression and irritation. The hormonal changes can be quite significant, but then you've got to go down the rabbit hole and find out where they're coming from. Alcohol consumption can do it. Again, going to the liver. The liver has to break down and get rid of alcohol. If there's not enough vitamin B complex, if there's not enough elements that drop the levels of inflammation, we know that glutathione, that's necessary, NAC, N-acetylcysteine, which converts into glutathione in the body. Sometimes you don't have the pathways to make that happen, and that can be the problem. So we have to look at all those things. How about stress? I had a patient that went to a dentist outside our area, and he did a lot of full mouth reconstruction on this person, and never really had any major problems with headaches. Every now and again, like a lot of us, we might get a little stiffness. And when I say now and again, less than a couple times a year. And she goes to this guy, and now she goes into these raging headaches and pain radiating from one side of her face all the way into her head. And she described it as somebody's got an ice pick and shoving it in my eye. And it only started after that. Why would that be the case? Well, the temporal mandibular joint, which is the hinge where you open and close your mouth, is the pump handle for the 22 bones that make up your head. And these 22 bones, they have little saw teeth interdigitations, and they're supposed to expand as you breathe in and come together. They pump the spinal fluid. And then in reciprocation, your pelvis and your spinal bones pump it back and forth and up and down. Now, if that temporomandibular joint is not set properly, I mean, it's sitting in its saddle the way it's supposed to be, now it can cause an aberration, an abnormal function, pressure, if you would, on those 22 bones. They jam, and pressure builds up because the spinal fluid can't move the way they're supposed to. That can cause a problem with what we're talking about. So you have to look beyond just why is the pain giving somebody such a hard time. Well, the pain is a pain, and this is inflammatory, and it can be vascular. And so what we need to do at that point is we have to absolutely find the triggering mechanism and go from there. There are common triggers, and we have to really understand what those common triggers are. So not only that we can avoid them, but really ask the question, why? Do you know that stress is a significant trigger for about, some authors will say up to 70% of people with migraines? So if you're constantly in a stress pattern, your body's tight, your muscles around your head and your face are going to lock down. It's one of those things that we say stress kills, but how many of us really understand the application? Now, we have to be able to manage the stress. We have to do the things that are necessary. Sometimes when we're under a stress pattern, everything begins to exaggerate in its impact in the body, and we don't know which came from. All of a sudden, our stomach is a problem. We talked, I think last week, we talked a little bit about that. One of the prodromals, the initiating presentations of a migraine is a stomach problem, but not always. But it can be there. Now, if we have changes in our sleep pattern, we need about 7 hours, 6.5 hours of really solid sleep. And I'm the guy for years and years and years that would get maybe 5.5 hours was a good night, and it has an impact. Fortunately, I was able to go to sleep and crash. I could get in the office, go in my office and close the door, and I could be out cold for 15 minutes. And you have those little power naps that everybody takes. Well, it saved me, but you need to repair. And to repair, you need to have consistent bedtime. The room has to be cool. There can't be any digital lights. You've heard me say this 100 times. And shoot for that 7-hour piece, 7-8 hours. Now, more sleep than that tells you that there may be a problem. And you have to understand that, too much or too little is really an issue, and you have to make some changes. We have to look at the caffeine production. Remember, we talked about earlier, the liver has to denature alcohol, but coffee can do the same thing. They can trigger migraines. And some of you are going to say, yeah, well, I take Excedrin because it has, the caffeine for some people will do the same thing. It will decrease it. Now, what's that all about? Well, it upregulates, it squeezes, it pushes your fight-flight system, your adrenal glands, putting out its own steroid. And the steroid is what decreases the inflammation. But what happens over time? If you have to resort to that, or you're drinking coffee all the time, pretty soon that fight-flight system is not going to work the way it's supposed to. So when you need it, it isn't there anymore. How about when we skip meals? Those can be major triggers as well. How about if we're not hydrated properly? Yep, we got a problem there as well. So start thinking through your lifestyle. Start thinking through the things that have an impact on your life, things that you've ignored. Well, not me. It's not something that is really problematic for my body. I'm tough. I can handle it. Maybe. And maybe not. So we really have to understand the process. We really have to get into what the triggering causes are, but more importantly, we have to be able to fix it. And those of you who have listened to me and either in the office or patients, or you've heard me on platform, when I talk about headaches, when I talk about migraine headaches, particularly, that's one of the reasons I do what I do today, because my wife had migraines from the time that she was 5 or 6 years old, and nobody could help her. And at one point, when we're in our 20s, just before we got married, 3 neurosurgeons said that the only way to fix it was to fuse her neck from cervical 2 vertebrae, the second cervical vertebrae in the neck, all the way down to cervical 7. I said, I don't think so. And we went to a clinic that did straight structural engineering type of adjusted patterns. And guess what happened? They were gone within 30 days. She stayed under care for quite some time to correct the reverse curve in her neck. But at the end of the day, I said, I don't have to do anything else. I'm in the perfect place for what I needed to do. Now, common causes. Let's get back into that just a little bit, because you really need to understand it. Migraine headaches can be triggered by so many different pieces. And we talked about imbalances in brain chemistry and so forth. And a little while ago, I mentioned that nerve that comes out of the temporomandibular joint, right? The trigeminal nerve. And that trigeminal nerve has 3 branches. It runs to the lower jawline, it runs to your cheekbone, and it runs to your forehead. And that nerve can be very problematic if there's any pressure on it, or if it has a viral pattern. It's a very common area for viruses to go into, particularly things that cause shingles, things that will live there, like Epstein-Barr virus, and those mechanisms have to be identified and treated properly. Your level of serotonin, your feel-good juice, if it falls, it can cause and trigger migraine. You go from high to all the way down to the lower end. It's critical that you understand that there's multiple pieces of this. But again, I want you to remember something that I said earlier. Everything in the neurochemical and somatic part of the body, meaning your organ system and the chemistry that your body produces, reflexes like a switchboard to your structural system, to the spine. And those little muscles that hold the bones in place, the ligaments that hold the bones in place, then are irritated, and they can cause a contraction, or they can have too much of a relaxation period, or they cause swelling and inflammation around the area. Then what happens? Then the vertebrae, the bones of your spine, and including the occiput, your skull that we're talking about, no longer have the positioning that they should, and they can cause a compression or a stretch or an inflammatory reaction on the nerves that exit, or the spinal cord itself, your coaxial cable. Subsequently, guess what happens? You're going to have all kinds of pain patterns across the board that's, you don't know where they came from. But once you understand it, once you get it, once you understand these triggering mechanisms, now you can begin to put the fire out if you really understand how to look for them. Listen, are you tired of going to your friendly doc? They're not bad guys, right? And they're sitting there with a computer, and they put everything in the computer, and they push a button, and the drug company tells them what drug to give to you, or they're going to inject you with Botox because they want to relax, the muscles around the back of your neck or your forehead. They're telling you that's what the issue is. By the way, let me tell you something about Botox. It's called a neurotoxin. It causes a toxic reaction in the muscle, and it paralyzes the muscle. Now, do you think that if you're injecting it in the base of your head or in your forehead or your face, that there's not going to be a problem that potentially can cause you permanency of some sort? That's a different story. We'll talk about that some other time, but just think about that for a while. But these hormonal changes, these medications that we take, like birth control, ladies, if you're on estrogen replacement therapy, if you're taking birth control or any other hormone, if it's not balanced properly, and if it's not a bioidentical hormone, you can trigger these things. But other women have fewer migraines when they take certain types of hormones. Why? Because they got lucky and they hit it the right way, and it balanced things out. So now they don't have things going on. So the majority of it, though, is when you add something to the system that's not buffered properly, it can cause an issue. So, we talked about the emotional stresses. We talked about migraine triggers like, anxiety and worry, and it causes a lot of tension, right? And that tension can make a migraine worse, or it can trigger the migraine. There are foods that can do it as well. We'll talk about the why behind that. Cheeses, blue cheese, well known, and what is that? A mold within your system, and the inflammatory level that goes in there is called aldehyde. We're coming up to a place where I need you to really understand what the mechanisms are so you can deal with them properly, so you can understand how these things come about. Why live with having to take medication just to function the rest of your life? Does it make sense? It doesn't to me. I don't get it. I don't understand it. But, if you want to have your life back, if you want to make sure that you have the capacity, to have a clear head and get up in the morning with a lot of energy, on the 13th, Wednesday night, the 13th, at the Roselle Center for Healing in Fairfax, we're going to cover this, and we're going to go through it piece by piece by piece by piece. It's an opportunity to find out how you can put the fire out. We're going to talk about headaches and migraines, so any kind of headache, if you will, but we're going to be able to distinguish them, and we're going to look at the pattern. If you look things up, you're going to see things like migraines and chronic migraines. What does that mean? Well, it just means you've been suffering with the damn thing for such a long period of time, and wouldn't it be nice to really get rid of it and not have to worry about what it was? Some people are triggered by lights, bright lights, loud sounds, smells, odors, and boom, you go right into a pattern. You know it's coming. You walk into something. How about jet lag? I fly all the time. I'm flying overseas. I'm flying across country. I'm teaching, doctors and their staff. If you have an interruption in your normal circadian rhythm, the normal, hour to 2 hours to 5 hours or 6 hours of where you are, you're going to have a potential problem because it disturbs you. I'm going to tell you why that is. I'm going to get into that on that Wednesday evening, the 13th, and Dr. Harlan Browning and I will be co-presenting. Those of you who know Dr. Browning, great guy. He's a diplomate in functional neurology, has a diplomate in functional nutrition. He's got a diplomate in applied kinesiology. He's been with me for years. He's my senior. This guy is amazing. He's got more information between those earlobes than 5 people that I know. You're going to enjoy that. And those of you who know him know that the information just keeps going. That's why we call him, by the way, the professor. We call Dr. Browning the professor because he can teach something that is extremely difficult and break it down into bite-sized pieces. And the man is really extraordinary. So you're going to enjoy that. He will be on live stream with me periodically, but join us that night. Join us on the 13th. And, I promise you, we're going to give you all kinds of things. Hey, have you ever had a headache triggered because of changes in the weather? The air pressure changes and subsequently, boom, you got it. Same thing happens for some people when they fly. And, the flight up or the flight down, particularly if they have to take off very quickly or land too fast, that change in pressure can be problematic. So we're coming up to, the place where I want to remind you that you don't have to live with stuff. You don't have to be the prisoner of medication the rest of your life. If you want to know how to not only prevent a migraine trigger, but you also want to know how to get rid of the problem, this is an opportunity for you. So go to rosellcare.com and register for the class, and we'll make sure that we give you as much data, as much information as we possibly can. And don't forget, as soon as we're done with the program, in a couple minutes, we're going to be on live stream, and we're going to be talking about thermographic imaging. All you have to do is go to drtomroselle.com or go to YouTube or go to any of your favorite social media sites, and we'll make that happen. And we're going to give you a lot more diagnostic information on pain patterns today, as well as what we're talking about right now, migraines and headaches. I enjoy this. I hope you're getting as much information. And remember, the reason I continue to do this is one reason and one reason only. You deserve it, but I love you all. Have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Migraines and Headaches on Wednesday, March 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.